technical session part 2 by Dr. Savitha. She is the medical superintendent of Vanivilas Hospital, Bengaluru. She is a professor and former head of the department. Dr. Savitha? Okay, she is a professor and former head of the department, Vanivilas Hospital, Bangalore Medical College and Research Center. She is the faculty since 2000. She is also a mentor and guide to countless undergraduates and postgraduates for 23 years. She is the comprehensive abortion care trainer, NACO expert trainer and examiner for UG-PG students. She is the head of high-risk pregnancy fellowship in BMCRA. She is the member of technical advisory committee for Government of Karnataka and also the ex-syndicate member of Rajiv Gandhi University of Health Sciences. Madam, over to you to share the Karnataka experience, please.
Good afternoon, everyone, and welcome to the post-lunch session. I think it's not time to sleep still, I think. So, about the background of NMTI at Vanivilas Hospital, Bengaluru. So, Government of India has selected Vanivilas Hospital, which is attached to Bangalore Medical College, to be the NMTI. Why Vanivilas Hospital? Because Karnataka, it is the tertiary referral center for whole Karnataka, and then we have around 15,000 to 16,000 deliveries per annum, and we have empty number of postgraduates. So the first thing is there is so much of load. Whatever a new this initiative of government, first it will be implemented in Vanivilas Hospital. Let it be a CAC training, which was their comprehensive abortion training, NACO training, or PPIUCD training. For everything, this was the nodal center. So same way the NMTA has come here. And the second thing is that we have all the budding obstetricians, our postgraduates, they get exposed to all these things also. So during their student life only, they have that. So in a way, it is better that it is implemented in Vanivilas Hospital. So they get the exposure to the midwifery also. So a gap assessment was done in 2020, which was fulfilled completely by end of January 2023. So what were the objectives of NMTI? So this institute is uniquely positioned to establish the professional midwifery through imparting high quality education to this new cadre of healthcare workers. With the strengthening of the midwifery care in Karnataka, we aim to provide access to quality maternal and newborn health services and promote natural birthing by promoting positive childbirth experience, promote respectful maternity care throughout pregnancy and childbirth, provide competent, safe, culturally sensitive care utilizing the midwifery management process to independently manage the care of the women throughout lifespan as experienced as described by the core competencies for basic midwifery practice. Utilize the midwifery management process to independently manage the care of the newborn from time of birth until 28 days of life, consulting, collaborating under or referring as indicated. So the first batch of NMTI started on 12th January 2023 at Vanivilas Hospital, and there were 25 students, among them 7 were from Andhra Pradesh and 18 from Karnataka. So for the for the course, the curriculum of GOI was followed, and they are back at work. Actually, so Telangana, Andhra 7 midwifery students have gone back to Andhra, and another 15 of Karnataka students, they are placed in our SMTI. We also have one SMTI in Bangalore and Mysore and Belgaum. They are working now at MLCUs over there. So these are some of the photographs of the NMTI first batch, where in the first batch we had 2 Karnataka male midwives also. That was well appreciated by everyone, and they conducted the deliveries also. I think we are the second to have the male midwives, I think. So these are some of the statistics. So before, for the first 6 months, So the total number of midwife facilitated births were 316. This is from January to June when they were before their exam. And total percentage of episiotomy was 16%, and primiparous mothers with no tears were 30%, and these are some of the alternating birthing positions which were followed, and they did the OP care also of 850 mothers, and mothers attended the childbirth classes around 49. So where was the place for to establish a MLCU? So as such, Vanivilas Hospital, it is a heritage building. We can't move a stone in that. So we had an old emergency OT which was converted into MLCU, high-tech MLCU, with the help of UNICEF and the Astrika Foundation. And it was, this MLCU started working from 30th June. So till that time, where were our midwives? The first 6 months they conducted 316 deliveries and all what I told. So I made them collaborate to work with our clean labor room. We call the low risk labor room as clean labor room, and they were working with them. So there were postgraduates, they were our midwives. So whenever our doctors used to go for rounds, the unit chiefs and all, so the midwives used to ask them that this is a low risk, can we take this patient? So with the consent of the consultants, they used to take charge of the patients, and they used to take care of them. So in that way, what happened was our postgraduates were also like exposed to what is the process of that midwifery is going on. So all those 300 and plus births were conducted in obstetric-led care unit by the midwives. So that was a strategy for me to build the bridge between the obstetricians and the midwives. So, and from 30th June 2023, our MLCU started working independently. So it is the first MLCU in public sector hospital in Karnataka. So there are currently 8 midwifery educators, that is state midwifery educators, 2 international midwifery educators and 2 national midwifery educators which are running our MLCU 24/7. So this is an old OT, emergency OT. I think the first picture you can see the light, the OT light which got dismantled, and there is a structure, iron structure which is hanging. So our midwives, they didn't wanted it to be removed so that they can use it for the suspension of that ribose. So that is being used, and there were little bit modification, not very major modifications. This is the old picture what you are seeing before the alteration, and this is the new thing which is seen. You can see in the second lower picture, we have made that partitions and all. So this is a waiting area. We have the gym balls for exercising and all. And many, the outsiders have visited that, and an MD NHM of central government also has visited, and she appreciated our center very well. So at MLCU, sorry for the mistake, that is August 23, it's typed 24. So from August 2023 to January 2024, the total number of births were 80 in the MLCU. And initially when there was less number of births, and slowly we are picking up for the past 2 months, at least we are having 40 to 50 per month. Every day maybe 1 or 2 births will be there. And this is the statistics of that. And the midwifery-led OP care is 475. So what are the good practices? So it is the first government NMTI in South India basically. And this and MLCU is the first MLCU in public sector hospitals. And as I have told, 25 students were there in the first batch. So acceptance of midwifery care model by doctors. I think all the obstetricians here, they will know what is the challenge. Because convincing the juniors or whatever, so bridging the gap, that was a major challenge even for me, because I was the only person motivated in the institute, and for everyone, because as being in a position of medical superintendent because I have some power and authority, so I can exercise that. That was one thing. So students, whether they like it or not, the colleagues, whether they like it or not, they have to accept it. But that can be put it in a smooth way also. I conducted a meeting between the doctors and the midwives. So we had an interactive session among them, and they presented what they are going to do and what are the cases they are going to select and all. So even now also we are having repeated meetings. Every month once they will come and interact with the gynecologist so that if there are any misunderstandings or whatever it is, so that will be cleared. So that will bridge the gap, and so that we can work in collaboration, as Madam Evita was telling. So that is very, very important. So they should be treated like colleagues. That was the one I took. And every day morning, when I do the parturition book, every day I sign in the morning. So I usually ask what are the cases, all those things. Meantime, I will ask also how many deliveries in the MLCU also, and they will give the feedback also, and what they are doing, what are the cases they are trying. So that constant follow-up from my side, that has helped. I mean, it's a very good support also. And they also, if they have any issues, they come to me, and so there is instant clearing of all these things. The issues will be cleared immediately. So that is how power can be utilized in a better way. That's what I just want to tell. And they adhere to the standard protocols of which cases they are going to select. So they are selecting the low risk cases, and sometimes when there are too less of the cases are not there, that time even our low risk, because this MLCU is adjacent to our clean labor room or the low risk labor room. So that is clean is low risk, and the MLCU is the very lowest risk labor room. They are adjacent. So whenever they have a less number of cases, they go to our labor room and try to talk to the patients, or whether they will talk to the postgraduates, and then they will take, previously we were not giving the induced cases. Spontaneous onset labor they used to take. Now they started taking the one gel induction cases, and they will monitor like that. So about the examination pattern, we have engaged the nursing board. We met the DME also, and the exam process, whatever they have to undergo at the end of 18 months. So that process is on, and there is a committee which is created, and the nursing board has assured us that they will be conducting the exams. So before telling thank you, I just want to share one recent event. Last Saturday, there was one IAS officer who used to come for consultation with me to our hospital. So her first delivery was in government hospital in Bellary in another district. So she was coming for the past 3 months she was coming to me. So and she's a very low risk. Obviously she's second gravida, first is a normal delivery, she has a very good height and all. So I just gave her an idea that you are a very good candidate for the MLCU, why can't you see our MLCU and decide. I took her, and then our midwives, they taught her exercises, and they told about what they are doing and all. From that time, so she decided that she will deliver in our MLCU, and this Saturday she delivered in MLCU. So she had 26 hours of ruptured membranes. Friday night she came with leak PV, she called, I said, it's okay, you have time, you can come. So she came, the whole night they were monitoring and all. And our junior obstetric colleagues, they were so apprehensive, madam, you are leaving her, she's PROM, we should do section, why you are leaving her and all. I just kept quiet. So she had good contractions, everything, and basically she was so relaxed in the MLCU, and after 26 hours she delivered a female child, and that propped up position. So she was, yesterday we had a press meet also, she wanted to bring it to the notice of the public that awareness should be created. See, she could have gone, many of the people asked me when I was present during the delivery. But I was just watching what our midwives are doing, and the midwives completely, they took charge of that, and she had a minimal first degree tear also. That's all. And everyone asked why an IAS officer is coming to government hospital. She has money, she can go to any private hospitals. So she told that, see, if we are not being in the administration and we are in the system, if we don't enter into the system and get the services, how can we advocate others that you go and take the public sector facilities? That was the one thing. And so she gave a press meet, I think Times of India, tomorrow or something, it may come also in the Karnataka, this thing, edition. So that, she was so much overwhelmed with the support what she got. I think she had only the last 15 minutes of pain. That was the only pain, she said. Rest of the time she was very, very comfortable. She delivered in a propped up position. So, and even her husband is he's a surgeon, in a ESI hospital. So after everything, delivery, everything, she said, Doctor, I took such a big risk coming to the public sector hospital because everyone in their family went to a corporate hospitals, and I had to convince so many, but you kept whatever risk I have taken, I am very, very happy. That was a response from her side, and it was really satisfying for us also, because many IAS officers come to us for second opinion and all. Our secretary also, his wife got operated and all. But she wanted to convey that to the public also. So we had that press meet and all. Anyway, we are like just 1 year old, and I have been listening to the talks from consultants from Fernandez, and it is really very nice. And my concerns are like how we are going to, extend this midwifery to whole of state. That is the way forward we have to think over, because I am only confined to one hospital. SMTI will start next month from in our hospital, and Mysore it has already started. There is one more to be started in Belgaum, I think. So thank you very much for your patient hearing. This is the first batch of our NMTI. Thank you. I thank the organizers for allowing me to share my experience. Thank you very much.